Okay, so now that we spoke about mechanisms of attention in the healthy brain, I want to spend the remainder of this lesson looking at deficits of attention. And I want to cover 3 deficits of attention in particular: extinction, neglect, and simultaneagnosia. Now, before doing this, I do have to point out one important thing, which you might know, but just to make sure we are all on the same page. You should know that the human brain is organized in a contralateral fashion. What I mean by that is that your right hemisphere receives information from the left side of the world, so from the left side of the visual field, from the left side of your body, and controls the left side of your body. Vice versa, the left hemisphere controls the right side of your body and receives information from the right side of your body and from the right side of your visual field. So in this sense, the brain has a contralateral organization. And I want to make sure these terms are clear because they will come up through the rest of this lesson. So when I say contralateral, I mean on the opposite side. If I say ipsilateral, I mean on the same side. To give you an example, if you take the point of view of the left hemisphere, then for the left hemisphere, the left visual field is the ipsilateral side. Conversely, the right visual field is the contralateral side. If you take the point of view of the right hemisphere, it's exactly the opposite. The right hemisphere, the right visual field is the ipsilateral side, and the left visual field is the contralateral side. Now, if you add a lesion, say that this person had a lesion, then in these cases, we would refer to the right side as the ipsilesional side, the same side as the lesion. And the left hemisphere, the left visual field would be referred to as the contralesional side. Okay, so this is just important vocabulary because I will use it throughout the rest of this lesson. Okay, so ipsi means same, contra obviously means opposite. So contralateral just means on the other side of one of the 2 hemispheres, whichever I'm talking about. But if I say contralesional, I mean whatever side the lesion is on, it's in the opposite visual field. And so, for example, if somebody had, given the contralateral organization of the brain, if somebody had a lesion on the right side, as I'm showing here in the right hemisphere, then their impairment would be contralesional. They would have a problem with the information in this part of the visual field, assuming it's a visual or attentional type impairment, as we will discuss. Conversely, they would probably have no impairment in the right visual field. Now, extinction is the failure to perceive or to respond to a stimulus that is shown in the contralesional side, if and only if there is also at the same time a stimulus in the ipsilesional side. Okay, let me show you what I mean. And if you want, I wrote it in plain English. I unpacked it down here, but let me give you an example which might be helpful. So you're seeing here a clinician, and the clinician, and right here you can see sort of the side of the head of the patient. And the clinician is saying, tell me which finger I move. And just so you know, the patient will respond from his own point of view. So if he says right, it's the patient's right. And if the patient says left, it's his left. Okay. So the clinician wiggles this finger and the patient says left. I should tell you, this patient has a lesion on the right side. So this finger is in the contralesional visual field. The patient sees it. It's in, quote unquote, it's in the bad visual field. Okay, the lesion is on the right, so the problem is with the visual field on the left. Yet, if a stimulus is presented here by itself, the patient can see it just fine. Then the clinician wiggles the other finger, and the patient, sure enough, says, you're wiggling the right one. And here's the key aspect of this. If the clinician wiggles both fingers at the same time, then the patient only sees the right one, meaning only sees the one in the ipsilesional side, meaning only sees the one in the good side. So in this sense, it's called extinction because you can see just fine a stimulus in either the contralateral or in the ipsilateral visual field if they're presented by themselves. However, if there is a stimulus in the ipsilateral field, let's say in the good side, then if you present one in the bad side, the one in the bad side doesn't get seen. So the one in the ipsilesional side, the one on the good side, extinguishes the one on the bad side. It always wins. Now, an important aspect of extinction is that it can happen in both hemispheres. It can result from damage both to the right hemisphere or to the left hemisphere. So you can have extinction either in the left visual field, if the damage is on the right, or in the right visual field, if the damage is on the left. Now, neglect, instead, is a failure to detect and to respond to. In fact, it's a failure of being aware of any stimulus presented in the contralesional side. So if you have, with a lesion on the right side, any stimulus on the left side would be ignored. In fact, the patient would be entirely unaware of the presence of such a stimulus. Now, importantly, these patients seem to have perfectly fine visual acuity. So it's not a visual impairment, and we're going to see this a little later on. It seems to be an attentional impairment. It is also commonly referred to as left neglect syndrome or HemiNeglect. But the reason I highlight the left neglect syndrome is because it seems to only occur, or at least for the most part, it seems to only occur when patients have damage to the right side of their brain. So it affects the left side of their visual field. It's very rare to get neglect after injury to the left side, or rather, to get lasting neglect after injury to the left side. And this issue will come back a little later on. Let me give you an example of what this might mean. I'm showing here on the right a number of healthy participants and neglect patients were shown a screen with some objects on them, and they had to search for something. What you will see on here are lines which depict where participants were looking at. So a line is literally the tracking of where the eyes went in this search. And if you see healthy volunteers, we really care for the blue lines mostly. They kind of look a little bit all over the place, right? And you can see that they explored the full visual field. Now look at what happens when you look at the patterns of eye movement of patients with neglect. Really, they only seem to look to the right side. And remember, we said that it's called left neglect syndrome because usually you only get lasting neglect from an injury to the right side. So the ignored side is almost always the left, which is exactly what you're seeing here. The left side has been pretty much ignored. However, they do seem to explore fairly normally the right side. And so, and you can see this, in a number of different ways. For example, if you ask them to copy a drawing, and you can see here 3 originals, these are actual drawings of patients who are trying to copy those original drawings. And you can see it's very striking. Essentially, the left side of objects seems to be missing. And I'll get back to this in just a moment. But see, if you look at the house, for example, the right side is right there. But the left side, there clearly is something off. Same thing with the little daisy right here. So there's one petal, the other petal, sorry, the two leaves, and then you can see the petals right here. And there are the petals on the right side, but no petals on the left side. In fact, even if you ask a patient to draw spontaneously, they will draw the right side and nothing on the left side, or very little on the left side. And the degree to which they ignore the left side also depends and might change over time. But it's very striking how the left side of the visual field keeps missing. Now, interestingly, I have to admit, HemiNeglect can be very funky in the way in which it presents. But a couple standard ways in which it presents can be either with respect to an egocentric frame of reference or an allocentric frame of reference. What I mean by this is that when patients have an egocentric type of HemiNeglect, what they ignore is the left side of the visual field with respect to them. So it's the left side with respect to them. The anchoring for left, what defines what is left is them. Okay, so anything to the left of the patient will be ignored. So for example, a patient with an egocentric HemiNeglect, frame of reference for the HemiNeglect, if you give them this little picture, they will draw this. And you can see they draw the tree, they draw a bit of the house, and then everything else here to their left gets ignored. However, you can also have allocentric HemiNeglect. And this is when the HemiNeglect is actually based, the impairment is based on the object. So what you are ignoring is the left of an object, not your left, but whatever is the left of the object. And in fact, it doesn't even matter what is the position of the object in space. If you rotate the object, they still keep ignoring whatever is the left with respect to the position of the object. So for example, right here, you can see that the patient drew the right side of the tree, the right side of the house, some part of the fencing, and the right side of the tree. But every time the left side is missing, and it's the left side of the object. It's not their own left side. The truth is that it's not always this clean, and probably egocentric and allocentric are correlated in several ways, co-occur more than people think. Now, one important aspect of HemiNeglect, as I said earlier, is that it's not just a visual impairment. See, neglect is different in the sense from hemianopia, also known as hemianopsia. Now, hemianopia is when patients really have a hole in a part of their visual field. And this typically follows from damage, early damage in the visual stream, so perhaps in the visual cortex. So these patients are effectively blind in a subset of their visual field. So if you were to give them this drawing, they would see the right side of it, and then they would have a gaping hole on the left side, and they are very aware that there's a hole there. So they will, they'll learn to move their eyes around to see at the whole image. But they are very aware that their vision is missing something. On the other hand, this is not the case for neglect patients. For neglect patients, it's not that they don't see this side or that they have a hole on that side. This side doesn't exist. So they see just fine, just they can't see to move their spotlight of attention towards the left side. If you ask them, they have no idea that there is a left side. To them, the center of their visual field, that is the left. There's nothing to that side. Their visual world, in terms of their awareness of the visual world, seems to go, if it's egocentric, from the middle and extends towards the right. There's just they don't even realize that they have an impairment unless somebody tells it to them. In fact, so what will happen with these patients for example, is that they will eat and they will only eat from the right side of the dish. And then they will learn that if they turn the dish, more food appears, but it just came out of nowhere as far as they are concerned. And patients will shave only the right side of their face. Sometimes they will dress only on the right side. So as far as they are concerned, the world doesn't extend beyond the center of their frame of reference. So they really don't know that there is something there. In fact, when confronted with mistakes they make or things like that, they will try to come up with excuses, sometimes fairly odd ones, because to them left doesn't make they don't have the brain resources to understand what left means anymore. To them, left is just, it's not that it's missing, like in the case of hemianopia, it's gone. Now, an interesting question, of course, is what is happening? What is the actual deficit that these patients are having? And it looks like there might be at least two. And now one is known as Ipsilational Hyperorienting. Now, this just means that patients tend to be always, their attention just seems to be only going towards the right visual field. And you can see this, or at least clinically. This is typically shown with a couple tasks. One is known as the cancellation task, which is what you see on the top of this drawing. And it goes like this. You show them a bunch of horizontal lines, and you just say, please mark all the lines that you see with a pen. And what they will do is they will start on the right side, so the good side, the ipsilational side, and they will mark each one, and they'll mark them, they'll kind of get somewhere towards the center, and then according to how severe their neglect is, they will stop right there. And they'll say, there you go, done. This is, right, that's it. Another task that is very typically used is the so-called line bisection task, which is this task right here. You give them a line and you just ask them, can you tell me where's the middle of, just mark the middle of the line. And as you can see, of course, their middle is very biased towards the ipsilational side, towards the good side. Again, as if, if you take this line right here, it looks like if this is what they perceive as the center, to them, the line, it probably ends right here, in the middle. This piece of the line just doesn't register. That piece of the line, as far as they are concerned, just doesn't exist. And now I should say, as I'll show you in a moment, it's more than just these visual things. It actually is a cognitive issue. So for example, this applies equally to number sequences, days of the week, months of the year. Just to give an example, for number sequences, if you just ask them, could you estimate the midpoint between 19 and 43? They would tell a number that is biased closer to the 43 than to the 19. Okay? So this is clearly a cognitive issue.